The charity fund in the sphere of support of social and cultural initiatives of Leila Adamyan presents Reproductive Tomorrow of Russia, the health of school children is our care. Good morning, dear friends and dear colleagues. We wish you a very happy holiday on the occasion of the Day of Knowledge. I believe that knowledge is power. It's the power of occupation, power of the family, power of the profession, power of the state, and I'm very happy that we have gathered in such a big and beautiful team here. This is an educational university which demonstrates the latest achievements in science and practice, mostly in the sphere of reproductive health. Those who weren't able to come here can watch us on internet, and right in front of me there is a TV set so I can see what we are saying, what we look like, and how great we are. You are going to be surprised that we have this lecturer who is a young man. The lecture was prepared together with Dr. Elena Veretskyevich about obesity in girls. And the presenter is Andrei Popridukhin. I'm sure that you will enjoy this lecture very much because each slide in this presentation is thoroughly composed. Andrei, in exactly 10 minutes I will stop you, alright? The timer is on. The presentation is titled Obesity, the fateful problem of the child and adolescent period, role in the disorders of the reproductive system. Thanks a lot for the introduction, Dr. Adamyan. Dear colleagues, the presentation is Obesity, the fateful problem of the child and adolescent period, role in the disorders of the reproductive system. We all have only negative associations around obesity, and it's well justified, and the definition of the WHO is a good confirmation to that, because obesity is a chronic and multifactor neurobehavioral recurrent illness with metabolic, biochemical, psychosocial, and most importantly, reproductive disorders. In terms of epidemiology, more than 1 billion people are overweight. In 2014, 41 million children aged 3 to 5 were obese. In Russia, it's 5%. Every year, at least 2.6% of people die from obesity. The causes of obesity, the genetic causes are in the first place, caused by complicated genetic regulation of hunger and satiation. And by today, we know about 600 genetic markers and genes associated with obesity. But there are also extra genetic causes of obesity, such as environment, culture, lack of optimal nutrition, negative side effects of a medicinal therapy, viruses, and factors associated with intestinal microbiota. And now we're coming to psychological causes, which stipulate and cause everything. They are constant stressful situations happening to a child, eating sweets to diminish stress, the way the child behaves at school, the way the child associates with teachers and peers, and we don't notice as the child is becoming overweight. Diagnosing obesity is easy. We determine the body weight index, which is a ratio between the body weight and the height of a person in power 2, expressed in meters. We have special tables, and according to the WHO recommendation, obesity is when the body weight is equal or greater than 2. Look at this very important slide. We can see that obesity affects practically all the organs and systems. It results in depressions, blood stroke risks, high blood pressure, diabetes, varicosity, disorders in the bladder, disorders in the locomotor system, skin pathologies, and problems with the stomach and intestines. How does obesity affect the reproductive system? It dysregulates the genetic system, changes the expression levels, and results in malfunctioning of the the reproductive system. Obesity badly affects the reproductive system by not only altering the genetic system, but also the epigenetic system. Besides, obesity results in hyperinsulinemia, and through hyperandrogenemia, through amplification of the generation of luteinizing hormones, your daughter will suffer changes, causing disorders in the homeostasis, and finally the girl will have disorders in the menstrual cycle. Also, the children that are shown on the slide have a higher resistance to insulin, they have greater growth factors, and these children have a higher oncological risk. An interesting fact is the paradigm that with the amplification of the disorders in the reproductive system, in parallel, the metabolic disorders are amplified too. In childhood, it means disorders, in the menstrual cycle, hirsutism, acne, and in adulthood, it results in miscarriages, abortions, worse life quality, higher risks of cancer, and diabetes type 2. So the person will face the consequences, and the childhood illnesses will surely manifest themselves in adulthood. It is a proven fact that girls who have problems such as excessive weight get pregnant in adolescence more often and are more often raped. Now, what are the obesity consequences in boys? They are excessive transformation of androgens to estrogens, which results in a hormonal disbalance, which later results in hypogonadism, thus to say the sexual organs are of a different size than they should be. Obesity in the area of reproductive organs suppresses spermatogenesis, and a young boy who is obese has anomalous spermatozoids, the composition of membrane lipids is altered, and more DNA molecules are damaged. The increase in the level of leptin, which is a hormone generated by fat, results in much lower generation of testosterone. This affects the erectile function and results in male infertility. To determine the root causes of obesity, we should study the patient's anamnesis, the family records, try to identify risk factors, and analyze the dietary habits. The examination includes anthropometry, general examination, and obligatorily determining the body weight index. In some cases, we also study the hormonal profile, in particular the carbohydrate and lipid metabolism, the liver functions. In some cases, we use instrumental studies, such as MRI diagnostics, X-ray of the brain structures. The obesity treatment must be comprehensive and include the corrections of the diet, correction of the physical activity, behavioral therapy, pharmaceutical therapy, and in some cases, surgery. The physical activity must be not only around building muscles, but also around strengthening bones. And on this slide you can see a child who is playing with a toy. Earlier, those toys made him to do some physical exercises, but today we have electric vehicles, electric cars, where the child is sitting and doing nothing. The diet must be diversified as much as possible and include all the major food product categories. It doesn't mean that the parents must limit their child in food, but exactly you, dear parents, are responsible for the right diet of your child, what he eats and drinks. You need to optimize the fatty acid contents, such as omega-3, omega-4, and observe the drinking water balance. The behavioral therapy must motivate the child, create goals and objectives. The school can help with that, where the child can relax and feel self-actualized. The pharmaceutical therapy is limited in the Russian Federation. The only medicine is Orlistat, which is allowed for treatment of obesity in children older than 12 years old, both abroad and in the Russian Federation. The bariatric surgery is the last resort for such children. It is used only when the body weight index is 50 kilograms or more, and when there are complications, such as diabetes, apnea of a moderate or grave degrees, and the age of a girl is older than 13. In conclusion, I would like to mention the 6 WHO recommendations, which are based on accurate analysis. They are eating healthy food, promotion of physical activities, food and physical exercises, not only during school years, but also in early childhood, body weight control, and most importantly, a good care before conception and during pregnancy. I wish you and your children to be happy and healthy. Thank you for your attention. We all thank Andrei. This man has been our student. He is a surgeon. He is in the surgery room all the time. He helps with preparing all the presentations. He loves his profession. I think that if nothing creates any obstacles in his life, then after a few years you will see him, just like many of my other assistants, among the people of whom the whole country can be proud. Till the next conferences of the Open University of Leila Adamyan.